Hi, my name is Bailey Greer, and this is my presentation for Bio 251. I chose to do more research on neural tube defects and decided to narrow it down to the timing of surgical intervention of common neural tube defects. So before I begin, I just wanted to tell you why I chose this topic because it's not a normal topic and it's kind of specific. I've actually seen neural tube defect surgeries performed, and so it was something that I was interested in and something that I knew a little bit about, and something that is definitely interesting to myself, and I feel it's also interesting to others. So what is a neural tube defect, also known as an NTD? So an NTD is a congenital malformation of the nervous system, and it usually occurs in the central nervous system, either in the brain or the spinal cord. I've chosen 3, and so there are different prevention and treatment options for each. However, there are some similarities and overarching prevention options and treatment options for each. Something else that I wanted to go ahead and introduce here in the beginning is the importance of environmental factors going into mostly prevention and treatment, accessibility and socioeconomic status, and that kind of stuff. So I'll talk about that a little bit more in depth as well. The thesis of my paper was to determine if there was a golden rule for timing of treatment for each of 3 different neural tube defects, and I chose spina bifida, tethered cord syndrome, and Chiari malformation 1. So I'll discuss each of those individually. So spina bifida, also known as myelomeningocele, that's its formal name, is actually the most common neural tube defect. It does have a pretty high percentage of prevention, actually. If the pregnant mother is taking the proper dosage of folic acid for about the first 10 weeks of pregnancy, she will actually decrease the risk that the child will have an NTD by about 70%. And this is important because the timing of the closing of the neural tube actually happens between gestation days 21 to 28, which is very early in the pregnancy. So it's important that if someone is trying to get pregnant or is expecting to be pregnant, they should be taking folic acid even before they're pregnant in order to make sure that the child has the proper dosage of folic acid from the beginning before they might even know that they're pregnant. So for treatment options, there are 2 options. There's postnatal, which would be after birth. So this would be surgery during the first couple months of life, depending on which type of spina bifida, as there are open types of spina bifida and closed types of spina bifida, depending on the level of exposure of the spinal cord. So the most interesting part of this is actually prenatal surgery. So this would entail actually performing surgery on the child before they're even born. And there are many perks to this, and there are also different complications associated with it. So for the first part, early surgical intervention and proper postoperative conditions are obviously very important to either one. Also the folic acid. So for the treatment options, for prenatal surgery, research actually shows that prenatal surgery lowers the risk that a child may need follow-up procedures, including a VP shunt or a ventriculoperitoneal shunt, which is used to shunt cerebrospinal fluid from the brain, from around the brain, out so that it decreases the pressure in the brain and around the brain. So actually performing the surgery before the child is born actually shows that the child may have a better chance at independence later in life, that they will have less complications, possibility of living an independent life and walking independently. The longer you wait to have surgery, the higher incidence of complications and lower quality of life in the future for the child. It's in a sensitive area around the spinal cord, so the longer you wait or the earlier you do it, it's really going to be best so that the child has more time to develop and is growing around it instead of growing with it. So recommended treatment would be prenatal surgery if it is available. Complications, there are a few complications for the mother. Two of those would be chorioamniotic separation, which is a fatal detachment of the amniotic membrane, and also placental abruption, which is not necessarily fatal. Another complication may be that it shortens the length of the pregnancy, so premature birth is also a possibility. So let's go on to the next one. So tethered cord is almost exactly what it sounds like. The spinal cord is actually stuck or adhered to something else in the spine. In the photo to the right, you can see what a normal spinal cord would look like in this case. And what would happen if it was actually a lipomeningocele, which means that the tethered cord, the spinal cord itself, is attached to a fatty growth at the base of the spine. Another option is attached to scar tissue. So that's another complication with tethered cord. I'll go ahead and talk about this. A complication would be reoccurrence of tethered cord, because as soon as you release it, the surgery itself causes scar tissue, and there is the possibility of the spinal cord actually reattaching. So there are quite a few incidences of children having to have multiple tethered cord surgeries. So this has a different process for diagnosis. This isn't necessarily something that is shown before birth or even at birth. It actually shows up in later childhood when they start showing symptoms of this issue. Symptoms include urinary issues. Usually wetting the bed is a common sign, especially in an older child, someone who is 7 to 10 years old. And it's not their fault. It's putting pressure on the nerves, and they're losing function on the lower end of their spinal cord. So the treatment for this is actually tethered cord release, which is a relatively simple procedure, but again, may have to be repeated multiple times. So recommended treatment would be to do the tethered cord release almost as soon as you find out what is actually happening. So MRIs and everything would be required for this in order to diagnose it. But in order to relieve symptoms, the best option is to go ahead and do surgery. So the last neural tube defect that I chose was Chiari malformation 1, which is a little bit different. It has to deal with the brain. It's actually a displacement of the cerebellar tonsils, which is the bottom end of the cerebellum, and there's 2 tonsils, through the foramen magnum and into the spinal canal. So it actually blocks flow of CSF through and around the spinal cord and into the spinal canal. So it does cause quite a few issues. Primarily headaches is the main way that this is shown up, unless somebody has some kind of other condition in which they had an MRI and they happen to see that they have a Chiari malformation. So again, this is something that arises in childhood or even adulthood. They're not really sure what sets it off and what makes somebody realize that these headaches are starting. But again, childhood, adulthood, and it is possible for somebody to go through their entire life having a Chiari malformation, but never having any symptoms, and they never need surgery. So this one, treatment is based on symptoms. If the person is asymptomatic and they have no issue with it, then they don't really need treatment. However, if it's causing headaches and pain and building up pockets of fluid called syrinx in the spinal canal, then a bony decompression is the best option. In a bony decompression, in the image to the right, you can see that they remove small parts of the base of the skull in order to widen the foramen magnum so that the cerebellum and the tonsils have more space and to open up CSF flow. And this again can be measured through MRIs to see before and after how much flow of CSF is getting through. Complications with this are pain and things like that associated with surgery. However, there are not many complications associated with it, as there is not really any, you're not coming in contact with the spinal cord or anything like that. So recommended treatment for this would be the bony decompression. However, if they're asymptomatic, they can choose not to have surgery. There would be no reason to have surgery to fix something that isn't causing a problem for them. So to conclude, overall, earlier the better. Sometimes even before birth is better. For spina bifida, it would be best to do prenatal surgery if it's possible. For tethered cord syndrome, as soon as they find out the symptoms and confirm the diagnosis, usually surgery is the best option so that the child has opportunity to regain bladder function and other things like that. And lastly, for Chiari, again, earlier the better, usually to relieve symptoms. But if the person is asymptomatic and they don't have a problem with it, it's not life-threatening. However, it may be in the future they end up having symptoms and they may decide to have surgery. So I would say that there probably is not a golden rule, just because each person is different, each defect is different. So overall, there's probably not a golden rule, but if there would be one, it would be that the earlier the better. And by saying earlier the better, I again am saying that earlier the better, meaning prevention. Making sure that people who are looking to get pregnant are aware that they should be taking steps before they even become pregnant to prevent neural tube defects. So earlier the better, of course. Preventing is the best option, and then after that, the earlier the surgical intervention, also the better. Thank you. Let me know if you have any questions.